psoriasis do you suffer from? Is it a plaque psoriasis, one that is most common in a lot of people, one that can be seen by scaly, rough patches of the skin that is normally itchy and painful, the one that can also be seborrheic? To say that it's seborrheic, it means it can attack your scalp. Or do you have a nail psoriasis, one that you will see by the white discoloration of the nails? Not only that, but also loosening your nail from the nail beds. Or perhaps do you suffer from the type called the gutite or inverse psoriasis, one that is caused by the bacteria called streptococcus, one that can appear in the folding parts of the skin like your groins, buttocks, as well as underneath your breasts. And we also have this type of psoriasis, erythrodermic type, one that can be chronic, to say that it happens over a long period of time, or acute psoriasis that happens in short period of time. There are numerous types of psoriasis out there. There is one that is related to arthritis, but I'm not going to talk about everything. I just want to relay this information to you so that you can be able to pick it and go do your thorough research from there. But that doesn't matter. What matters is, do you have a treatment that works? And if so, could you kindly please comment down below so that we can educate other people and share our knowledge. Hi, my name is VIt D Analogue and I am a former laboratory testing technician in cosmetics manufacturing in South Africa, and I also suffered from severe eczema for over a period of 6 months. It must be noted that I am not associated with dermatology or dermatology. I didn't do dermatology. I'm not a dermatology person. I am not even coming from a healthcare setting. If anything, I am from a chemistry background. But because I suffered so much, I then took a quite strong interest when it comes to understanding dermatological skin conditions. It is your responsibility in knowing the dermatological skin condition you're suffering from. It is also your responsibility to understand that you have to ask the right questions, because with the right questions comes the right answers, and the right answers will lead you to the correct treatment. So today we're exploring some of the treatment that I have found when it comes to the psoriasis. And I must say, in this instance, this particular treatment that I'm going to talk about has to do with the hypothesis that exists that says that psoriasis can also be caused by the rapid multiplication of cells of the keratinocyte of your epidermis, okay, which is the outer layer of your skin. I know this isn't the first time I'm talking about this, that the upper layer of your skin, called epidermis, is made of cells called the keratinocytes. And I also mentioned that these cells keep multiplying, getting rid of the old cells so that the new cells can form. And I made an analogy to say, think of your great-grandmom, your grandmother, your mother, you as the daughter, and then your child and their child. This is why we'll see the wounds getting healed, the scars being getting rid of, and all of that. That is a healthy thing to do. But in a case where now this process is overdone, where we see rapid growing of the new cells, then the thin outer layer of the skin, which is the epidermis, get thick, and this is where we have these symptoms erupting. So the vitamin D analogues that I'm going to talk about works directly with that kind of cause, because you'd remember that in my previous one I mentioned that psoriasis can also be immune mediated disease, which means it might be triggered by the confused immune system, and I explained what that means. So in this instance, I just want to ask you, have you ever come across a medication called calcipotriol or calcitriol? If you have, good for you, because that is a vitamin D analog that is used to treat mild to moderate symptoms of psoriasis. To say that symptoms are mild to moderate, it means they're not so extreme, but at the same time they are noticeable and they are more than just minimal. So you are not so severe that we need to call an ambulance right now, but at the same time you are not okay, so you're just in the middle. And they are safe to use even over a prolonged usage, and one can get this over counter, and not over counter, but via a prescription, and they can apply it 2 to 3 times a day. So how does the mechanism work? So I've already mentioned the rapid growing of the cells, the keratinocyte cells sometimes, which is not a good thing if overdone, right? So in this case, think of psoriasis equals multiple cells, and multiple cells equals a problem. So vitamin D analogues just put them in between, they try and balance them, because low concentrations of the vitamin D analogues promotes the growth of the keratinocyte. Yes, low concentration of the vitamin D analog promotes the growth of these cells, because remember, it's a healthy thing to do, but if overdone, then it stops the production. So think of it as like it keeps it on the balance. So we are going to explore another mechanism of the autoimmune that we talked about on the previous video, and then we're going to try examine the cure that is related, or that can be related to that. So up until I see you on my next video, bye.